Hello, and welcome to Your Health, Wealth, and Happiness. We all need sleep, but sometimes it isn't easy to get enough sleep. Today we'll be discussing sleep disorders, the types of disorders there are, and what we can do to make falling asleep just a little bit easier. Joining us today we have Dr. Sadiq. Thank you for being here today, Doctor.
Happy to be here as always.
Oh, we're always happy to have you. So let's just dive right in. What are some sleep disorders?
Actually, sleep disorders are the conditions that interrupt or disturb a typical sleep pattern. They are pretty common. 40 million of people in US are suffering from these chronic sleep disorder problems.
Wow, that's a lot of people.
That's a lot of people.
Are there different kinds of sleep disorders, or is this just a general thing?
Actually, there are kind of around 80 or so sleep disorders, and some are very common and some are not that common. Insomnia is one of the very common one, which is we see a lot. Then sleep apnea is one. Restless leg syndrome, that's also one of a very common one. Then parasomnia and circadian rhythm disturbance is also there. So these are pretty few common one, but there is a lot more.
I'll say over 80? Wow.
Yeah, it is a lot.
So what causes a sleep disorder? Why are they so prevalent?
There can be multiple reasons. Sometimes patients are having these chronic problems, chronic health conditions like diabetes, heart problem, lung problem, and they are causing these sleep disorders. But other than that, they are also medication side effect, and genetic also plays a role in sleep disorders. So, but there can be multiple causes.
If I'm tired during the day, does that mean I could have a sleep disorder?
Possibly, but we need to investigate.
All right. How will we know if we have a sleep disorder or if we're just tired? What are some of the symptoms of a sleep disorder that we should keep an eye out for?
Yeah, we should look for some of the symptoms, like if we are actually sleeping, it is taking us a longer time to fall asleep, like 30 minutes or so, not able to sleep. That's one of the signs. Sometimes I have seen that people fall asleep at the wrong time. That is a very dangerous one. Or they feel very fatigued. At times they are feeling muscle weakness, tingling, numbness. They are all problematic symptoms, and at times also they feel actually very tired. If you are feeling that kind of symptoms, that's noticeable and one should see the doctor.
And those symptoms, they can vary depending on what disorder you have, correct?
Correct.
What should a doctor look for if we're to be diagnosed with a sleep disorder?
I would recommend that everyone should have a good, nice physical exam by a doctor. But other than that, during that physical exam, doctor will find out if they have some physical problems which are causing the sleep problem, and there are some which can do that. So good physical exam is very important. And also polysomnogram, which is we do a study where we read the sleep patterns. We also look for how the brain waves are, how your breathing rate is, how your heart rate is, and how your blood pressure is. So these are the things we should be looking for.
Well, that's all interesting.
Yeah.
So someone who has experienced symptoms of a sleep disorder, how long should they wait before they go to see the doctor?
If the symptoms are actually interfering your daily life, then you should not wait. You must see the doctor as soon as possible because it can be dangerous. But if you are having like mild symptoms, fatigue, weakness, or not concentrating at work or at home, so if the symptoms are lasting more than 3-4 weeks, you must see the doctor. But if you are falling asleep on your wheel while you're driving, or you cannot breathe during your sleep and you're waking up with the difficulty, so you must see the doctor as soon as possible.
Is there a specific group of people who seem to be more prone to insomnia?
Actually, women are more prone to insomnia. 40 million of people are suffering from insomnia, but unfortunately women are more prone.
Oh dear. So what are the most common sleep disorders that we're most prone to?
People who are suffering from insomnia typically experience low energy, fatigue, lack of concentration, and mood swings. They will be very irritated and they will make their family's life miserable.
Oh no. Well, for those suffering from sleep disorders, how can they get that treated to help their families?
That's very important.
Yes.
Good night's sleep is very important. Some lifestyle changes are good. They should eat healthy. Exercise is very good. And if this basic change in lifestyle is not helping, then there are behavioral therapy, there are cognitive therapy, there are other techniques which can help them to overcome this sleep disorder.
I've heard there's a machine called a CPAP. What exactly is it, and how can it help patients?
CPAP is a machine which is actually, we utilize that for sleep apnea. It is a machine which keeps our airway open. It is not a breather, and it is not a machine which is giving oxygen, but it is only helping us to keep our airway open so a patient breathe in and out very easily.
And how many people would you reckon have sleep apnea?
I think there are a lot, maybe 25 million or so people, adults are having this problem, and it's more common in men, unfortunately.
In the beginning of the interview, you mentioned getting the right amount of sleep each night. What are the amount of hours that we should be getting a night of sleep?
Actually, minimum 7 hours at least, and 7 to 9 is good for adult, but usually teenagers also 8 to 10 hours, but mostly they are on their phones, so they must know that sleep is very important. For children, they can have 9 to 14 hours. But I must say one thing over here, sleeping between actually 10 to 12 midnight, 10 p.m. to 12 midnight is very, very important, because during that time our brain produces dopamine, and the dopamine is very good for your sleep, and also dopamine actually helps you with the good memory, and also prevent to have a person getting the Parkinsonism. Sleeping between 10 to 12 midnight, even you get half an hour or an hour sleep during that time, you will get that dopamine for that night. Because if you will lose the dopamine quota for tonight, you will not get it for tomorrow. So I must recommend sleeping between this time is very important.
Well, I'll make sure to keep that in mind.
Yes.
I'm sure our viewers love that information too. Do you have anything else that you want to add about sleep disorders?
Eat healthy, that's very, very important. Eat vegetable and fruits instead of a lot of carbohydrates. That will help your sleep. And also one last thing is that exercise, even daily walking. If you cannot go to gym, just walk in the house. Do the household work, put some dishes in, clean your kitchen, clean your bedroom, do some vacuum. So a little bit activity will help you. And if having any insomnia, I would suggest that try a hot milk with 1 teaspoon of honey and also 1 banana at night. These are good sleeper.
Well, that's all we have for today, viewers. Thank you again, Dr. Sadiq, for being here. Until next time, viewers, stay healthy, happy, and live better.